Hello everyone. Today video is about nervous system. Last videos we discussed about what are the system in our body, what are the roles of the system in our body. Today video about nervous system. Nervous system is the body's information processing center. First point, body's information processing center. Next one, coordinating action and sensory input by transmitting signals between brain and the rest of the body. First point, it is the body's information processing center. It is the information processing center. Next point is coordinating action and sensory input by transmitting the signals between both brain and the rest of the body. This is the definition of the nervous system. Next, it is divided into two types: central nervous system and peripheral nervous system. Central nervous system means brain and spinal cord. Next, peripheral nervous system, all other nerves except brain and spinal cord. The system taking sensory information. It is the main role of sensory information and processing it and triggers reaction from simple reflex to complex thoughts. Next, main division means central nervous system. It is a consist of brain and spinal cord. It receives, process and respond to sensory information. First of all, it is the consist of the brain and the spinal cord. It receives the process and respond to the sensory information. Next one, peripheral nervous system. Peripheral nervous system, it includes all the nerves outside the brain and the spinal cord through branch out of the rest of the body. That is peripheral nervous system. What are the key functions of nervous system? Means coordinate action, process sensory information and enable complex functions. Next one, division of the peripheral nervous system. What are the divisions? Means somatic nervous system, autonomic nervous system. Somatic nervous system means control voluntary movements of skeletal muscles. Next, autonomic nervous system, it regulates the involuntary body functions. There are two types in the autonomic nervous system. Division of the peripheral nervous system means there are two types. First one is somatic nervous system. Somatic nervous system means control voluntary movements of the skeletal muscles. Control the voluntary movements of the skeletal muscles. ANS means autonomic nervous system. There are two types: sympathetic division and parasympathetic division. Sympathetic division means prepares the body for the fight or flight response to the stress by increasing heart rate and respiration. Next, parasympathetic division means manage the rest and digest state, slowing the heart rate and aiding digestion to return the body and state of the balance. It maintain the balance. Next, what are the nervous system basic unit? Means the fundamental unit of nervous system is the neuron or nervous cell. Basic unit means nervous system consists the basic unit, that means neuron or nerve cells. Next, neurons. Neurons means transmit electrochemical nerve impulse to the other neurons and the body cells, that is neurons. Neurons means what? Transmit electrochemical nerve impulses to other neurons and other body cells. How many neurons in the brain? Means millions of neurons. Okay. Next, what are the diseases involved in the nervous system? Many of the diseases involved in the nervous system. First, we will see the Alzheimer's disease. Alzheimer's disease is a progressive brain disorder. Progressive brain disorder that slowly destroys the memory and thinking cells, eventually affecting the ability to carry out simple tasks. This main thing means progressive brain disorder. It is the progressive brain disorder that slowly destroy the two things. One is memory skills and thinking skills, eventually affecting the ability to carry out simple tasks. It is the most common cause of the dementia, characterized by buildup of amyloid plaques and tangles in the brains, which leads to the death of the brain and cells. The key symptoms. What are the symptoms involved in this? Confusions, recent events, problem solving, reasoning, language, which worsen over time, lead to changes in behavior and personality. Main thing is confusion and problems with problem solving. That is the main symptoms of the Alzheimer's disease. Next one is symptoms and progression. But there are three types: early stage, middle stage and later stage. Early stage means difficulty remembering the recent events and losing things and getting lost in family places and confusion. This is the early stage. Middle stage means difficulty with language, recognizing close family and friends and performing the family tasks, and personality changes and mood swings can also occur. Late stage means loss of the ability to perform basic daily activities and communicate. There are three types: early stage, middle stage and later age. Early stage means difficulty remembering recent events, next losing things, next getting lost in familiar places and confusion. Middle stage means difficulty with language, recognizing close family and friends and performing familiar tasks, and personality changes and mood swings can also occur. Late stage means loss of the ability to perform basic daily activities and communicate. What are the causes? The exact cause is not fully understood, okay, but it is linked with abnormal buildup of proteins, okay, abnormal buildup of proteins called amyloid plaques. That is name is amyloid plaques, and talk tangles in the brain. But unknown, this is the unknown cause. Okay. What is the prevention? As the cause is not entirely clear, there is no known to way to prevent Alzheimer. However, managing lifestyle factors, control the lifestyle activities like maintaining healthy weight, eating balanced diet, staying physically and mentally active, and avoiding smoking may help reduce the risk of or delay onset of dementia. Okay. This is the first disease. What this means? Alzheimer's disease. Alzheimer's disease is the progressive disorder. Okay, it is the progressive disorder that slowly destroys memory skills and thinking skills, eventually affecting the ability to carry out of the simple tasks. This is the Alzheimer's disease. Next one is Parkinson disease. Parkinson disease, it is also the progressive disorder. It is a progressive neurodegenerative disorder that primarily affects movement and causing symptoms like tremor, slowness of movement, and bradykinesia, and muscle stiffness and impaired balance. It is the definition of Parkinson disease. What it means? It is a progressive neurodegenerative disorder that primarily affect the movement, our body movement, and causing symptoms like tremor. Tremor means tremor at rest. In the position we simply sitting, tremor at rest. That is the tremor at rest, slowness of movement, that is called bradykinesia, and also muscle stiffness and impaired balance. It is the definition of Parkinson disease. It is caused by the loss of brain. It is caused by the loss of brain cells that produce dopamine, that chemical that helps the smooth and coordinated movement. There is no cure treatment like medication, support therapies like physical and speech therapy. Surgery can also manage symptoms. Okay. Next one is, what are the symptoms involved in the Parkinson disease? Means tremor, often starting in the limb and typically one side of the body. Next is slow movement. Slow movement means bradykinesia, rigidity, stiffness, and post-uteral instability or trouble with the balance. Next, changes in speech and like a softer voice, that is called hypoponia. Problems with the handwriting such as smell and cramped writing. Next one is a mask-like facial expression, that is means hypomimia. Hypoponia means it is a softer voice, changes in speech, that is called hypoponia. Next one is hypomimia, means a mask-like facial expression. That is called hypomimia. Next one is non-motor symptoms, means loss of smell, sleep problems, mood disorders like depression, constipation. What are the causes involved in? Means dopamine deficiency, low level of dopamine, that is called Parkinson disease. Okay. Dopamine deficiency means nerve cells in a part of the brain that produce dopamine are damaged or die. Next is genetics. Some cases have the genetic link through the most cases don't appear to run in families. Next, environmental factors. Exposed to certain pesticides and herbicides may increase the risk, but the evidence is not conclusive. Next one is age factor. The risk increase sharply with age, with the average age of onset around 60 age about. Next, what are the diagnoses? There is no specific test of the Parkinson's disease based on the doctor's evaluation of symptoms, medical history, and neurological examination. Main diagnosis: symptoms, medical history, and neurological examination. What are the first line drug is levodopa. Levodopa is a common medicine that is a brain converts to dopamine. Levodopa and carbidopa. Other medications work by the mimicking dopamine and slowing breakdown. What are the supportive therapies in the Parkinson's disease? Means physiotherapy, occupational therapy, speech therapy, help manage the motor and non-motor symptoms. Next is surgery. What are the surgery? Means deep brain stimulation. That means DBS may be option for the severe cases that would not respond to well to medication. It is the Parkinson's disease. Okay, these are the main two disease involved in the nervous system, and another one disease we will discuss the next video. Okay, here in this video we will discuss about what is nervous system, what are the disease involved in the nervous system. First one is Alzheimer's disease, second one is Parkinson disease. These are the two diseases involved in the nervous system. Next more disease involved in the nervous system means we will discuss about what are the disease involved in the nervous system, what are the symptoms, what are the causes. Okay, we will see the next video. Okay, thank you.